Well, welcome everyone. Again, I'm Nicole Fisher. I'm the Clinical Education Manager at HealthInfoNet, and we want to welcome you to today's webinar with a focus on supporting long-term care use cases and interventions. So we are working here at HealthInfoNet on really highlighting some areas of users as our use of the clinical portal has grown. There are lots of different folks throughout the medical and behavioral health community that are using our tools and services. And so we decided for this quarter of 2020 that we would work on designing some supports and additional education materials for those folks who are working in the areas of long-term care. And certainly, as we get started in today's webinar, just a couple things to keep in mind. Obviously, this does have the long-term care focus, but I do feel like there's a lot of components of this that could be used in multiple different areas. So even if you're not working in long-term care, or if you're working in home care and hospice or assisted living, I still think there are some components of the webinar that you certainly will find useful. And I am lucky today to have a co-presenter with me, Janet Edgecombe, who is the Director of Nursing at Stillwater Healthcare. She has been gracious enough to participate in this webinar with me and share some of her use case of the clinical portal. And so I'm really happy that Janet was able to join us today. So we will hear from her in a little bit. Today we're going to go over a little bit of the webinar, which will and have this PowerPoint. And then I'm going to go ahead and do a demo too of our clinical portal for maybe some of those folks who have never seen it before or who haven't been in it recently, to just go over some key areas that I think folks would want to know about today. So webinar objectives, obviously to identify and review some of those long-term care use cases and interventions. As I mentioned, be able to understand the data and how you'd be able to incorporate it in the care that you provide your patients. As well as how you would want to have the clinical portal be a part of your current workflow to help improve care coordination and your safety goals. So we've highlighted some really specific interventions here that we feel folks working with a long-term care lens could really utilize the clinical portal for. So when you're thinking about when you're getting referral information, or you're talking about pre-admitting somebody to your facility, you want to be able to gather medical histories prior to that admission. You want to be able to review any hospitalizations, ED reports, look at allergies, medications, where have they been previous to a particular PCP? Have they been to, have they needed radiology, or if you're looking for immunization reports? And also to help with chronic condition management. And talking about medications, so being able to review the pharmacy claims data that we have in the clinical portal, so making sure there's no duplicate prescriptions, any unnecessary or inappropriate dosing levels for medications. And obviously care coordination is important, so being able to identify who a patient is seeing, whether it's a specialist or their primary care provider, to really help with that transition period would be really helpful to know who they've seen. And then also to be able to update care plans on an ongoing basis that would also too help with comprehensive review of documentation. Managing transitions of care. So if you do have a patient who leaves your facility, goes to the emergency department, or gets admitted to the hospital and then ends up coming back to you, being able to review medications, look at any necessary, outpatient follow-up where you would need to coordinate transportation or any staffing needs that you might need to be thinking about, as well as does this patient require any equipment needs that weren't something that they had previous to this event of care. Being able to identify gaps of care or overuse. Has the patient already had a lab drawn? Did they already get that radiology procedure? Being able to make sure that they're getting the necessary care they need, but also to make sure that they're not getting any of that repeat testing. and to reduce the need for any unnecessary documentation for reimbursement. And then to inform your quality reporting. So when talking about the MDS, the minimum data set sheets, you're looking at your active diagnoses, pain assessments, fall history, medication, immunizations and procedures. All of that information are things that you can find right in the clinical portal. So I'm going to pause there for 1 second, and I'm going to ask Janet to unmute herself and be able to maybe share some highlights of how you use the clinical portal, Janet, as well as how do you work in the clinical portal to your everyday clinical workflows that you're doing for your patients throughout the day.
Well, hello, everyone. I just want to say, first of all, that I definitely love the HealthInfoNet portal. I think that's why they asked me to talk about it, because last time we discussed it together, I went on and on about how wonderful it is, and it's really, really true. The thing about the portal is it is really a clearinghouse of health information for our clients. It's really a one-stop shop. So you get to go to this clearinghouse and find out all of the information that you need for your clients, either before they get there, after you send them to the emergency room, as you're waiting to get information whether they had a fracture or not. It's very important that we have this portal. What we use it for most, we use it if we're wondering, has this patient had their pneumo immunization? Have they had their flu shot yet? As you know, as long-term care providers, we need that information timely. We have now one MDS that we can submit for payment. And if we don't have those immunizations timely for that one MDS, we don't get that as a credit. So to be able to go into the HealthInfoNet, get that information, instead of calling multiple providers, it's so easy. Another thing that we do, we talked about this already on the slide, is for med reconciliation. That is a requirement of us, that we reconcile the medications our patients are on. By looking into HealthInfoNet, we can see what they were on in the hospital this time. We can also access what they were on in the hospital, maybe a prior visit. And we can reconcile what they are on when they come to us. We can also ask the patients, what are you on at home? And we can reconcile all those different areas of information to get the client the care they need. We use it as a care planning device. There's many things I can talk about. I'm sure I'll have an opportunity to tell you some more. Allergy listing, for example. Just last week, we had a patient who had, when I did a chart review, he had an allergy listed from 2016 that suddenly fell off. And I didn't catch it till I did my chart review. It didn't fall off the record under my care, but he had it in 2016 as a listed allergy, and then when he came to us from the hospital, it wasn't there anymore. So I was able to go into HealthInfoNet and maybe track that back to see what happened to that allergy. Is it a true allergy, and why are we not capturing it now? These are the types of things that you can do with HealthInfoNet, because it gives us access in a timely way, so we're not wasting valuable time that we don't have calling up multiple providers. They've done the work for us. Like I said, I love it. I can go on and on about it if you'd like me to continue.
Sure. So maybe, Janet, what we'll do is I will move sort of into the demo, and then certainly as you want to highlight anything or shout anything out that you think folks might be helpful for folks, we can certainly do that. Does that sound okay?
It does, because I have multiple examples anecdotally of things that have happened here that we've been able to really use HealthInfoNet to help our clients.
No,
so
that's great.
That.
Yeah, so absolutely. Shout them out as they come to you. And I'm going to go ahead and share a different screen here and get to the clinical portal. So bear with me one second here as we transition. So as you'll see, this is my test environment. So there's no PHI here that you will see. This is the normal screen, though, that users would see once they log into the clinical portal. This is our demographic search screen. So I am going to go ahead and just briefly show how you search for a patient, and then we'll get into a good test patient to show some more information. But ultimately, how I educate folks, you start with first name and last name, and click enter, and you're going to get all of your patients listed here. We do have folks, the clinical portal, for those that don't know, is an opt-out program. So for each participating organization that is a participant with us, they do all follow a consent workflow, which is educating patients one time only of their consent options with HealthInfoNet in the clinical portal. And so everybody's information is in the clinical portal until they choose to opt out, which they can do at any time. They can also opt back in at any time. But if you ever see, which I get this question sometimes a lot, is if you go to click on a patient and you can't open the record, that means they have opted out. You'll notice that that is just a lock there and not a lock and plus sign. So that's just one thing to make note of. This Minnie Mouse here above, which is unlocked, this was a Minnie Mouse that I used for training actually this morning that I did with a group of folks. And so I did open this patient record, this particular Minnie Mouse from Skowhegan. So if I wanted to go back into this patient record, I could right now. And I wouldn't have to break our privacy seal to be able to do that. And this would remain in the unlock status for me, as for my individual account as an individual user, for 3 days. And then after 3 days, I would need to break the privacy seal again to open up the record. So I'm just going to go through that process really quickly right now with this Minnie Mouse from Randolph here, just to show you what that process looks like. This is the patient record that I'm supposed to be able to open. I have a right to enter this record. I know that this process is indicating that I need to select a reason for entering the record. Say I'm working at a long-term care facility, I would click long-term care. And by clicking this break privacy seal, I know that by me entering this record, it would be recorded and it could be audited in the future for compliance purposes. We do get this question asked a lot around whose record they should be opening and not opening. It is really important to note that anybody who's at your facility or a patient that you currently are working with and have a treating relationship with, and you are a participant with us, you can access that information. It actually starts, that treating relationship starts upon referral. So for those folks who are working in a referral capacity and working on pre-admissions, as soon as that referral comes to you, that does give you the ability to be able to open up the patient record. So once I've selected that reason and I understand here, I break the privacy seal and it opens up the record for me. So as I mentioned, this is just for demo purposes here. So I am going to go back out to my menu screen here with the little 3 lines, and I'm going to go to recent patients because my test patient that I educate folks on is in this list here. So also for folks who don't know, this recent patients area of the clinical portal will show you the last 50 patient records that you have open. So rather than having to go through the demographic search and typing in your patient's name and needing to know the date of birth, if you know you've been in the record before, certainly come to recent patients to save yourself some clicks. And I'm going to go ahead and open up my test patient here.
Can I interrupt for 1 second?
Please, go ahead, Janet.
Yeah, I just wanted to let you know that of all the times I've used this, I've only had a patient opt out twice. So it doesn't happen very often, but I can tell you every time it happens, I'm very disappointed.
I'm sure we do. That's a very good point. Thank you, Janet. So we do have, and certainly Chad, you can correct me, but I believe the opt-out rate is about 1.4. So it is a very low number of folks who do choose to opt out. So that is a really good point, Janet, and I know people will certainly bring that up during the times that I've educated folks around those patients that have opted out. Which obviously, you know, as a provider, if you want to have that conversation, certainly around the benefits of how you would use the portal for, sometimes that's helpful. But obviously at the end of the day, as I mentioned, we remain very objective here at HealthInfoNet around patients' choice for wanting to opt out. So certainly they have every right to want to do that as well. But great point. So here,
opt in, if say I opt in now, but I had opted out as of yesterday. The information I had will only be present from today on.
Correct. Yes. So we don't hold on to any of that previous data. And so if somebody does choose to say they were opted out, like Janet said, they choose to opt back in, the data collection starts from the day they choose to opt back in forward. Great point as well. So here, as I've opened the record, this is sort of the view that you will see. It defaults to this patient summary screen, where you will initially see some demographic information. So when you think about the data that's in the clinical portal, about 95% of it is real-time data, which means that those participants that have what we call a bidirectional connection with us, so not only are they viewing data, but they're also sending us data. Those folks that are sending us that data, we have that direct connection to their EHR system. And so we're getting a large majority of that data in real time. Just as soon as somebody completes a registration, finalizes a document, updates any information at any of their encounters, you know, that comes right to us at HealthInfoNet. So when we're talking about demographic information, this is information that if somebody is seen by anybody throughout the state that's participating with us, you know, this could be very current demographic information. So that's always important to note. There is primary care provider information here if it's been sent to us, as well as emergency contact information. And in this patient summary view, the real highlights here obviously are allergies, as Janet mentioned, active problems. So here you're going to see some more detailed information around allergies that patients have, reaction and severity if it's sent to us, when did we get that information, and then who sent it to us. So if there is more information that you want to know about this allergy, you can certainly know where it came from. And because we're a little bit tight on space in some of these views, we have abbreviated the location here. So anything with an asterisk, it's always really important that you're hovering over and you're getting more information in detail by doing that. It's going to give you the full printout of that location. Sort of below, right next to allergies, below demographics here are our active problems. So this is an active problem list of diagnoses that have been sent to us by various providers that patients have seen. So you're going to get a description of that active problem. You're going to get when it was sent to us and the location as well. So even if, and depending upon the participant that's sending data, everybody sends us a different types of data, different amounts of data. A lot of it has to do from a technical perspective and what folks are able to do from a technical capacity. So for example, if Wilson Stream Family Practice here is a good example, say they are only able to send us encounter information, demographics, active problems and allergies, but no documents. You as a provider who's, say, getting a new admission can certainly see, though, where this patient has been and where they have received care in the past. So if a patient can't remember who a particular provider was that they saw or where they received care, because they may have multiple providers that they've seen recently and in the past, you can come here and say, oh, okay, I need a little bit more information from Wilson Stream Family Practice. You may still have to go through, you know, a consent workflow, but at least it's giving you an idea of where this patient was seen before and where did they receive care to really help with your care coordination process. Below that is our medication. Yeah, go ahead, Janice.
To talk about the codes, right now it's very important that we have specific diagnosis codes, and if any bit of information that can be shared, especially with specificity, is awesome. So if it comes from the primary care, the hospital, EMS, wherever we can get that data so that we can compare it and get the correct ICD-10 code, it helps. So that you have it right up front is really helpful. So I so appreciate that.
That is great. Thanks, Janet. So below that is prescription medications. So there are some caveats with prescriptions that's a little bit different than other parts of the portal here. So we get prescription information from two different sources as it stands right now. So one of those sources is a pharmacy claims database called SureScripts. So if you think about the life of a prescription, a provider orders a prescription for a patient. Most likely nowadays, usually things are done by sort of e-prescription, so it gets sent electronically to the pharmacy. The pharmacy goes to process that prescription. It gets sent to a patient's insurance, and then they're able to fill the script. So where the pharmacy claims database SureScripts comes into play is when that prescription goes to a health insurance to be billed. And then we're able to pull in that information. So it is any commercial insurance, it is Medicare, so anything like that would be included in the data that we get from SureScripts. Where there are some caveats is that if a patient has paid cash, or if a patient has used a prescription coupon or drug program where it may not have been processed through their insurance, that wouldn't be here. So that's why we say that this medication section is not 100% of med reconciliation, but it does give you a good idea. We also do get a pharmacy claims file from Maine Care, or the Medicaid program here in the state. We do get that once a month. It's usually around the beginning of the month that we get that file, we process it, we upload it here, and it's for users to be able to view. So those are the two areas of medication information that we get in this view here in the patient summary. I will also say that I educate folks to really also, look here to see what we have for medications. What is here is going to tell you a lot. What is not here will also tell you a lot, and it can open up some conversations with patients around maybe issues they were having with picking up their prescriptions. So, maybe they did pay cash, maybe they did use a coupon program, but maybe they didn't have transportation to be able to go pick up that script, and so they missed it for several months. So there's a lot that can open up some really good discussion and some transparency with patients around what you see here. But I will also highlight going over to our document tree, which we're going to go over here in a minute, where all of our documents are, but definitely take a look through some of those and see, has this patient been admitted to the hospital? Have they gone to the ED? Are we getting office visit notes from their outpatient providers, where there could be also a medication listed there that can help sort of connect any of those dots. And then below that is our encounter visit history table. So this is also really going to highlight and show what's been going on with a patient most recently. Where have they been? What's been going on? So there's many different types of encounters that can be listed in this table. Outpatient, emergency, inpatient, pre-admit. They are pre-admitted for a surgery. There are also swing beds and reoccurring type appointments, such as infusions or physical therapy, chemotherapy. Any of those type of things will also be listed in this table. It's here you'll know when these encounters occurred with an admission date. You'll see a discharge date if applicable. Where did the service, or what type of service did they receive at this visit? there's a chief complaint. It will be listed here, as well as who they saw as a provider. And then on the second half of this table is really some diagnosis coding information. So as Janet mentioned, those codes above and active problems, also being able to come here. And because of also too space purposes, we have condensed things. So really important that anything with an asterisk, you're highlighting or hovering over and getting more information around that diagnosis coding or category. And there may be times where multiple diagnoses are listed and we're only able to put one there. So it's also really important that you hover over and get a full sort of printout at those other diagnoses listed. You're going to also get insurance type in this view, as well as location too. So similar to the active problems and allergies, you'll know exactly where the event of care occurred at which location. Anything else you want to touch upon, Janet, before I move on to our document tree? And this patient summary view?
I'll wait for the document tree.
Okay, great. So next to the patient summary here is our document tree, which I will open up just to make a little bit bigger here on your screen. So similar to folks' email, everything here as you open up, say, a new patient that you've never opened a record for, everything would be bold until you opened up and you saw the document, and then it would become unbold. So very similar to email here. But this is a really good snapshot here in my test patient of some of the areas that can be listed for folks for documents that we could have: care plans, consultations, your hospital reports, your emergency room reports, immunizations, laboratory, microbiology, operative and diagnostic procedures. This is office visit outpatient notes and OV outpatient. You get your radiology reports here and vital signs. And so the really cool thing about this is that with the connection that we have with our bidirectional participants is if I open up this discharge summary, it will look exactly the same as if I were to get this directly from Northern Light Eastern Maine Medical Center's Medical Records Department. If I had gone through my original paper workflow for consent and had the patient sign a release of information, faxed it to medical records, and then waited to get the information back, it's here right at your fingertips that you can log into the portal and you can view this discharge summary. So all of the same components here. Same thing with an emergency room record. So all of the same components here. If I were to have reached out to St. Joe's and got it right from that facility. So I won't necessarily go into each one of these different categories, but another one that I always really like to highlight for users is our laboratory results. So oftentimes folks, they are very interested in labs for their patients, right? And so we really try to make this as user-friendly as possible. And so making this color-coded for folks. So black is normal, yellow is abnormal, red is critical. And when you click on the particular laboratory results here, very similar to those other documents, you're going to get all of the necessary information you need to continue to treat your patient safely. You're going to know that laboratory result. You're going to know when it was ordered, where did they go, all of that. You can also, which is a really neat function I always show folks because I really think it's very cool, is that next to this where it says CBC without differential, there's a little hyperlink in case folks aren't aware where it says view cumulative results. And you can actually graph trends for particular laboratory results. I'm just going to randomly pick an H&H here. It's not going to look as pretty as I want it to with my test patient, but just to show you how it could work, it is a really neat functionality that we have within labs where you can do that and sort of see any changes over time for particular lab results. You can show these to patients if they're working on something. If they're working on their HbA1c and you want to show them how they're doing. So it has lots of different uses and you can print it. There's a little print button there. So if you ever want to do that, that is available for folks. Just a couple of quick tips and tricks before we move on here. But the document tree does default to category. But you can always come up to this little, looks like an eye here, and you can group and sort this list in a couple of different ways. If this is a resident or a patient of yours who, say, had to go to the hospital, was admitted for a few days, and then ended up coming back to you, you've been in the record before, you're very familiar with some other documents that are in there, but you really just want to focus in on the last 72 hours or the last week. You can come up to show here, and it gives you different date criteria. You can actually specify a date range, but you can definitely break it down and only look at the last 72 hours when that patient was in the hospital to view all of the documents from that particular event of care. You can also group by service. So it will show you where has a patient been, where have they received services throughout the state, as well as provider. So if you're really looking for something, you know, a specific provider ordered, you can always come in here and sort it by that as well. Another great functionality to the document tree here is that if you are short on time or you're only logging into a particular patient to pull out something very specific, you can always come here to the magnifying glass and come in here to the box. And I always joke around everyone's favorite procedure here, colonoscopy. And as I start to type it, it will pull up the colonoscopy reports that I'm looking for my patient, and then I can easily just open up those documents as I need to. Similar with a particular lab result, let's say, if you're looking for a particular lab, you can always come in and do that. Anything you would add, Janet, in regards to documents?
Yeah, it's really helpful for comparison data. For instance, if you send someone after a fall, it's nice to have the comparison x-rays. It's nice to have comparison labs. If you draw labs at your facility, you can compare the prior labs from the hospital. It's nice if you send someone to the emergency room, you're concerned about them, you're concerned, is there a reportable fracture? You can check it before you get report so that you can get that report off to the state really quickly. It's just nice to have all this information right at your fingertips. The other thing I like the document tree for is wound care needs. Sometimes we get patients sent and the wound care is complicated. We don't necessarily have all the information we need, and we can go into that consult section and get clearer information.
That's a great example, Janet. Thank you. That is awesome. So overall, that's pretty much what a typical, record would look like. Nothing that you can delete, remove, do anything like that. So no worries there. Hopefully, it's also pretty intuitive that you're able to find things pretty easily. I don't know, Janet, if you found that to be the case, that overall it's pretty easy to maneuver throughout a record for a patient. Okay. Anything else you would add here, Janet, before I pop back over to our PowerPoint before we start to wrap things up a little bit and then maybe get to some question and answer? I don't know if Janet's still on mute or not. Oh, maybe we lost her. That's okay. She can always add to it. So let me change my screen for the final time here and head back over to our PowerPoint. Just touch upon a few things. So, I think we've talked a little bit about this. earlier in the webinar, but obviously, we wanted to highlight some common challenges that happen in long-term care. So being able to, as we mentioned, piece together some of these complex medical histories from various resources when you're talking about getting a referral or a new admission. Being able to update a patient's care plan following their discharge from the hospital, know who they might need follow-up with, being able to help with that transition of care, and being able to get sort of that complete picture and making sure you're decreasing any chance of any adverse effects. And then readmitting patients, when they go to the ED or they go to the hospital and they're going back and forth a lot, that may be something that's happening for some of your residents and patients there. And so you're able to understand that the needs of those patients when they're coming back to you, and how you may need to change things with your staffing or with the patient's care plan or transportation or anything like that ongoing. So obviously the portal can help with those components. So being able to get sort of that bigger picture, being able to provide that comprehensive care, have accurate information, improve your quality reporting and cost outcomes through that reduction in testing, being able to decrease any medication hospitalizations, maybe avoiding a hospitalization or a readmission altogether. Those are certainly some components of the clinical portal that we feel folks can benefit from. And then we made a sort of a visual of that care workflow when thinking about patients, say, who have an ED admission or they're sent to the hospital, and how there is that long-term care transition. So being able to prepare for that re-intake and looking at that report, seeing if any labs were drawn in the hospital, did they have an x-ray or a CT, what medications were dispensed during that time or prescribed during that time. And then once the patient does come to you, being able to go through and look at the allergies and immunizations and the things that Janet mentioned earlier, so that you can really develop that solid care plan for your patient, and re-engage folks to make sure that you're reducing the need for any further hospitalization, to improve that quality of care, assessing a patient's risk, and making sure everybody at the facility is up to date with what that patient needs moving forward. So I did just want to do a couple of housekeeping things before we get to some question and answer here at the end. So this is our clinical education team at HealthInfoNet. So myself and Sharon Bear. Some folks may be familiar with Sharon, who is a phenomenal educator with us. Obviously, things are a little bit different from us as trainers. Now, we were sort of road warriors for a really long time, and we always really enjoyed that component of our work here at HealthInfoNet, was going out and visiting with folks and meeting with them at their agencies, organizations, facilities. And obviously, because of COVID, that's changed things a little bit. But we are very willing to jump on webinar trainings. We have a lot of different resources now on our website. We have this PowerPoint available. We will have this webinar available. We are recording it, so it will be available for folks for future usage. We have a web-based tutorial program, our HIN Academy, which is available for folks with actually some highlight to long-term care too. There's a specific long-term care course that folks can take. So if you have anybody who wasn't able to attend the webinar and they're interested in more information, or if you want to reference something later, we do have lots of information on the website and with our HIN Academy. We have here our phone numbers and our emails should you need to reach out to us. And as I mentioned on the website, we have lots of different training materials for folks if you're looking for more information. So I will take a pause for a minute here and see if there were questions, Chad, as he was looking at the chat here.
Yeah, thanks, Nicole. So before we get into the Q&A, I'm just going to show my screen really quickly. And in the comments, I'm going to drop a chat to give you all of this information as well. So apologies for monopolizing the chat for a minute. And so just a couple of resources to show you that Nicole was speaking to. We have our HealthInfoNet Academy course. And this is a new site that we just redesigned now that virtual learning is kind of the new normal. So as Nicole said, if you wanted to share what was said during this webinar, we'll have the recording. But we also have a separate course that we can provide to end users. Go to all courses, go to the long-term care case study, and it's a lot of the same information with additional materials that are available to you in your facilities. So feel free to use this resource. All that you would have to do is log into the site for the first time, and then it's off and running from there. We also have a PDF, which kind of describes it more succinctly and more high-level value proposition. If you have some new users or new organizations that you'd like to bring on board to the HIE, we can provide this to you. And then lastly, like Janet said, we spoke with her through a Zoom call not too long ago, and we captured some of her more extended thoughts on the use of the clinical portal, along with some additional folks from Genesis, Physician Services, and other long-term care participants as well. So our YouTube channel is public. I provided the link to it in the chat. Feel free to go here and get some more understanding of how other actual end users are using the tool. Lastly, we send out a notification through email, likely tomorrow or by the end of the week, with all of these materials. And this link here that will come back to our webinar page will provide all of this information and more as kind of a repository. If you forget something that we talked about today, chances are you'll be able to find it on this page. So with that quick plug done, just going back to the chat, and feel free others to please add in any questions or comments that you have into the chat. We can address them now. Nicole, one that we did have was around the consent process, and didn't know if you could kind of speak to the patient experience of opting in and opting out, and how often are they able to change their consent choices over time?
Before she does that, I want to say Janet's back. I'm sorry I had an emergency.
No, that's okay. I don't know, Janet, maybe this is a good first question for you, and then I can certainly supplement. But is there anything around the patient consent process that you guys are doing that maybe you could speak to for others that would be helpful?
For HIN?
Yes.
When we come across somebody that has opted out in the past, we do approach them, and because a lot of times it's a decision they made before, and it may be a decision they didn't understand, and it may be a decision that has changed because now when they're in a facility, the needs are different. So we do go and reapproach it and discuss it with them or their POA or their legal guardian, and just give them the facts and say, this is how we would like to use it, and this is how it would benefit your plan of care. And we do approach them, and it's been successful. So that's what we do.
Great. So and that's definitely good to know for folks. I will say, so initially how the consent model works is that every participating provider with us has to educate their patient one time only of their consent choices, which ultimately means they can opt out. So it's discussing it with them, and that's all of our participants. So whether you're sharing data, whether you're just viewing the data, there has to be a process in place that those patients are given their consent options and them given their right to opt out. Many folks have different ways that they go about doing that. Usually it's done as part of an intake process or the registration process, where they're provided with the information around HealthInfoNet. Certainly, you know, to Janet's example, people can do it on an ongoing basis. You know, if they do see somebody who has opted out and they want to go back and have a discussion with them about it, that's certainly something that can be done from an organization's perspective. But for those folks that are, you know, participants with us, and their consent requirements is that it does happen one time only whenever you have a new patient to your facility or organization. Great question.
And I would say our clients, 90% of them have pretty significant dementia at this point. So it changes the landscape quite a bit. They can no longer tell us some of that information themselves. So I think it changes how we would need to go about getting information that perhaps prior they could have given themselves.
Sure, that's a good point as well, Janet. And obviously being able to work with the patient themselves, be able to work with their legal guardians or their POAs or whoever's the decision-making person, you know, as well, is an important piece to that too. Great point. Other questions, Chad, or anything else we should?
I think that covers it in the chat, Nicole. Yeah, so if folks have any additional questions, again, feel free to add them to the chat. You could unmute yourselves and ask Nicole directly, but we can stay on the line for maybe 5 more minutes to see if anything comes in. Otherwise, I think that's the end of today's presentation. So thanks everybody for joining.
And thank you to Janet for taking the time. We know how busy everyone is, obviously. And so thank you, Janet, for working with us and helping us. And hopefully folks can really take away some of your use case and your advice. So we thank you so much.